The purpose of this video is to explain the process of examining arterial blood gas results to determine the type of acid-base imbalance. First things first, you need to memorize these important normal parameters. Normal blood pH is 7.35 to 7.45. Normal partial pressure of carbon dioxide is 35 to 45. An easy way to remember this is to just bring down these two numbers. Normal bicarb levels are 22 to 26. You'll also recall that carbon dioxide is what we refer to as the respiratory factor, and bicarb you can think of as a metabolic factor. You'll recall the ABCs of ABGs. It's a process in which we examine ABGs in a systematic manner. Whenever I go to examine ABGs, I always make note of normal values. Normal pH, 7.35 to 7.45. Bring these numbers down to get the normal partial pressure carbon dioxide, 35 to 45, and bicarb normal levels are 22 to 26. Let's get started. Step A. Look at the pH to determine whether you're dealing with an acidosis or an alkalosis. This is probably one of those simpler steps. We know that normal pH is 7.35 to 7.45. We know less than 7.35, you're dealing with an acidosis. Greater than 7.45, you're dealing with an alkalosis. Moving on to step B. You want to determine the arrows, or the direction, in which the remaining values are going compared to the pH. And this is what tells you the type of imbalance, whether it's respiratory imbalance or metabolic imbalance. The key factor here is remembering the Rome method. RO standing for respiratory opposite, meaning that in a respiratory imbalance, the pH and the respiratory factor go in opposite directions. ME stands for metabolic equal, meaning that in metabolic disturbances, the pH and the bicarb, or the metabolic factor, go in the same direction. Let's say that we have a situation where we have a pH of 7.33, which is low, and a partial pressure carbon dioxide reading, which is 47, which if we look at our normals, we know it's high. Based on this, we see that the pH and the respiratory factor are going in opposite directions. We can tell that this is a respiratory disturbance. Respiratory acidosis, to be exact. Let's look at another example. You have a pH of 7.47, which of course compared to normal is high. And let's say that you have a bicarb reading of 28, which is also high. Given that these two factors are going in the same direction, we know that the primary disturbance is metabolic in nature. Metabolic alkalosis, to be exact. Step C. Next, we want to determine whether the body is compensating for this imbalance in any way. If so, we want to know the state of compensation. Let's recall the types of compensation. The first is what we call uncompensated. This is when the pH is abnormal and the primary component is abnormal. So let's say that if it's a respiratory acidosis, the pH is low and the partial pressure of carbon dioxide is high. What differentiates uncompensated, however, from the rest is that the other component is still in normal range. So no adjustments have yet been made to the renal or the respiratory system. A second state of compensation is what we call compensated. And there are two subtypes of this. One which we call partially compensated and one which is fully compensated. In partial compensation, all the pH and all other values, so the bicarb and the carbon dioxide, are abnormal. meaning that the lungs or the kidneys have begun to compensate. In fully compensated, the pH has returned to normal, but other values, the bicarb and the carbon dioxide, remain abnormal. The final state is what we call corrected. And this is a state in which all values have returned to normal. This is what we want to happen. Let's look at a few examples. Here's the first. We have a pH of 7.32. We have a partial pressure of carbon dioxide of 46, and we have a bicarb of 25. Now let's recall our normal values. And once again, I always like to write these up in a corner of my paper. So normal value of pH is 7.35 to 7.45. Normal partial pressure of carbon dioxide, once again, 35 to 45. And normal bicarb is 22 to 26. Step 1, look at the pH to determine what type of imbalance we're looking at. We know that the pH in this scenario is 7.32, which is decreased from normal. We know that this is a case of acidosis. Step B, we want to determine the arrows for the remaining values to determine the type of imbalance. Remember Rome. Respiratory opposite, metabolic equal. So let's see. We know that the pH is low. We know that the partial pressure of carbon dioxide is high. So right away, we can determine that this is a respiratory imbalance. Once again, in a respiratory imbalance, the pH and the primary component of the respiratory system, which of course is carbon dioxide, are going in opposite directions, respiratory opposite. So we can tell right now that this is respiratory in nature. Respiratory acidosis. Of course, bringing that down. Step C, determine whether the body is compensating for the imbalance. Let's have a quick look at the bicarb up here. We know that the bicarb is normal. Looking back at the types of compensation, we know that the pH and the primary factor are altered, with the other factor being normal in an uncompensated state. The kidneys in this situation have not yet begun retaining or producing more bicarb to compensate. Given that only the pH and the primary value are abnormal, with the secondary component being normal, we can conclude that this is a case of uncompensated respiratory acidosis. Let's look at another example. Let's say that we have a pH of 7.47, partial pressure of carbon dioxide of 48, and we have a bicarb of 28. Once again, always write your normal values. Step 1, consider the pH. Once again, given that normal pH is 7.35 to 7.45, we know 7.47 is high. This is a case of alkalosis. Next, we want to determine the arrows for the remaining values, remembering Rome. Respiratory opposite, metabolic equal. Once again, in respiratory, the pH and the partial pressure of carbon dioxide go in opposite directions. In metabolic disturbances, the pH and the bicarb go in the same direction. So let's look. So it looks like we have a case, pH of course is high, carbon dioxide compared to normal is high, so right away we know that it's not respiratory. They would be going in opposite directions, the PaCO2 and the pH if it was respiratory. We also see that the bicarb is high. And if we go back to Rome, we know that in metabolic disturbance, the pH and the metabolic factor, being the bicarb, go in the same direction. So we know that this is a metabolic disturbance, more specifically, metabolic alkalosis. Step C, we want to determine whether or not the body is compensating for this imbalance, and if so, the type of compensation. we recall that in an uncompensated state, the pH and the primary factor are abnormal, but the secondary factor remains within normal limits. So in this case, we know it's metabolic, so the pH and the primary factor are abnormal. In this case, the secondary factor is not within normal limits. The PaCO2 is elevated. It would appear that the lungs have begun to slow their breathing to try their best to retain acid to balance out the alkalosis. We see that all factors are abnormal. Recalling our definitions for the state of compensation, we know that these ABGs represent a case of partially compensated metabolic alkalosis.